been in A&E for 3 hours, all because I sprained my ankle. I bet AI could have made it happen in 30 minutes. I have little to no patience, so waiting that long in a hospital, not knowing when you'll be called, was absolute hell.
Let me first say that I fully appreciate the ingenuity and the innovation to try and create a solution to this really frustrating problem. And secondly, I fully understand that it is the most annoying thing to wait in a hospital and not know when you're going to be seen, especially as that wait time feels like it goes on forever. However, there is a slight issue with this. In hospitals, we operate a triage system, which means that we focus on seeing the most unwell patients first. So if you have a relatively minor injury or ailment, like you sprain your ankle or you have a small cut on your finger, you aren't the priority if someone more unwell comes in to see us, so someone with a heart attack or with life-threatening sepsis. We need to see them first. And so if we were to create a system where you could see your time slot, you'll be seen in half an hour, what happens if we then have to delay that by another half an hour or an hour or longer? It ends up being even more frustrating as the patient. The other tricky thing is that we don't know how long it will take to see each patient before you. It's not like there's a fixed length of time for each patient in the hospital to be seen. Someone who comes in with a relatively small issue may only take 10-15 minutes to be addressed, but someone with a more serious issue, that could take much longer, half an hour or even an hour. It also depends on how many members of staff are there that day. There's so many different factors that could determine the amount of time before you are seen. What can perhaps be more helpful would be to see your order in the queue. So are you 3rd or 10th? But again, it can be even more frustrating to see you getting bumped lower and lower because more unwell patients come in. And when this has been tried in hospitals, often patients feel more frustrated and they come up to the receptionist and take their anger out on them, which is not a good idea. But again, I appreciate the intention to try and fix this frustrating problem. But what's a much bigger issue is that right now, there are actually hundreds of doctors who are willing to work and have tried to apply to training programs, but there aren't actually spaces available for them. The only way doctors who have come out of medical school and started their training can continue to hone their skills and become a specialist is to enter a training program. And this is an issue that affects multiple different specialties. So if you want to be a surgeon or a gynecologist or a pediatrician, there's such high competition levels and such few numbers of jobs available that there are hundreds of doctors going on without jobs. And you can imagine how frustrating that is, not just for doctors, but for the patients who already have high waiting lists to be seen. And we have so many doctors who are willing and want to work, but they are not being given those jobs. So if you're finding yourself frustrated with how the NHS works, I encourage you to write to your local MP and tell them your frustration. It's not difficult, but it does require funding.